So what exactly is an adverse drug effect and what are the two important ways of classifying it? Let's talk about that in this video. Hi, this is Dr. Avinash. I'm the medical coaching expert and I'm on a mission to help 1,000,000 medicos clear the basics, upgrade the knowledge and excel in their clinical practice. Let's talk about adverse drug effect. Now, whenever we give any drugs to our patients, we are taking a risk, and this risk is of an undesired, unwanted, unexpected action of the drug. Adverse effect is any undesired or unintended consequence of drug administration. It can be trivial, it can be serious, sometimes it can be fatal also. See, whenever we give any drugs to a patient, we are taking a risk. And as a good doctor, you need to do something called as the risk-benefit analysis. The risk should be less, the benefit of giving the drug should be more. Let me give you an example to help you understand this concept better. Imagine a cancer chemotherapeutic drug. Now, these drugs have the potential to kill rapidly multiplying cells, right? Our bone marrow contains rapidly multiplying cells. So, if you give a cancer chemotherapeutic drug to a patient who is not suffering from cancer, his bone marrow may get suppressed, he will suffer from anemia, he will have no WBCs production, no platelet production, and he can even die. That's why cancer chemotherapeutic drugs in a normal individual are a strict no-no. But the same drug can be given to a patient suffering from cancer. Here, the risk of bone marrow suppression is way lesser compared to the benefit of the possibility of curing the patient of cancer. Getting the idea, right? Imagine a patient who has common cold. A patient who has common cold needs to be given an antihistaminic. Now, the previous generations of antihistaminics, they produced sedation as a side effect. So the patient would fall asleep very easily. Do you think it is possible for a patient who is sedated to go about his day-to-day activities? Not really, right? And for a common cold to keep a patient at home sedated makes no sense. And that's the reason why something as simple as sedation in a case of common cold and antihistaminics is not an acceptable side effect. I hope I'm making myself really clear. So how do you classify these reactions? Well, there are two ways of classification. The first method is called as the predictable versus non-predictable reactions. And the second way is based on severity of these adverse drug reactions. A predictable type of adverse drug effect, also known as type A or augmented reactions, are based on the pharmacological action of the drug. So if you know the pharmacological action, you automatically know the side effects of the drug, the toxic effect of the drug, and even you can predict what will happen when you stop the drug. So drug withdrawal. These are much more common, they are very dose related, they are preventable, and they are very reversible. Compare this with type B or unpredictable or bizarre reactions. These are not based on the pharmacological properties of the drug. They are actually based on the genotype of the patient peculiarities. These include drug allergies and idiosyncrasies. We'll talk about idiosyncrasies and drug allergies eventually in some other lecture. But these are less common, but they are much more serious. They require withdrawal of drug. So we need to be careful about them. The only way we can predict these unpredictable drug reactions is by checking the genotype of the patient. So if you know the genetic basis of a particular type of unpredictable reaction and you check for that gene in your patient, you might be able to predict the unpredictable reaction. The second way of classifying adverse drug effect is based on the severity. Now it can be classified into 4 subcategories. Minor, where you do not require any therapy, you don't require any antidote, you don't require any prolongation of hospitalization. Second is called as moderate. This requires a change in the drug therapy. Maybe an antidote might be required. You may have to prolong the hospital stay of the patient by at least 1 day. The third is severe, where this is potentially life threatening and it can cause permanent damage to your patient. It requires intensive medical care. And the fourth is lethal. Lethal, of course, means the drug that you have given directly or indirectly is responsible for the death of the patient. So there you have it. Now you know what is an adverse drug effect and what are the two ways of classifying them. I hope you have understood this. I believe you will become a part of my VIP group where you get one-on-one coaching, not only for your university exams but also for your MDS NEET preparation. So join me right away. The details are already given on the screen in front of you. Drop in a message. Let's get you started on your highway to success. This is Dr. Avinash signing off. I will see you in my next lecture. Till then, take care. Bye.